Hey everybody, welcome to our Facebook Live today. This is Monica Palacio. I have a special guest with me tonight, but we're just going to take a minute to wait for our listeners to catch up and log on. I'm sure they've had a long week. I want to say thank you first to all our essential workers. Our talk tonight, our show is going to focus on nurses and essential workers and how we need to do more to advocate for them and making sure they have the protective gear they need and that they're staying safe as they do their very important work. So we're going to just stand by for a moment as people join us on Facebook Live. Welcome, everybody. Okay, so we're going to get started. My name is Monica Palacio. I'm running to win a seat on the DC Council this November, the at-large seat representing the entire city. I'm very proud to be the first Latina ever in the history of the city to run for a seat on the DC Council. I've been in the district for 30 years. I've had many roles. Some of those roles include formerly director of the Office of Human Rights under Mayor Gray and Mayor Bowser, but also working across the city on violence prevention efforts, working with returning citizens, working with families in crisis, and working with young kids to try to keep them out of the criminal justice system. So it's an honor to be a DC resident for 30 years. And I'm very excited to welcome tonight Rolando Delgado, who has been a nurse for 12 years, and he has currently been working at Mary Center for 5 years. We want to discuss the topic of the need for PPE, personal protective equipment, for our frontline workers. So welcome, Rolando. Why don't you say hello and introduce yourself as well?
Hello, everybody. My name is Rolando Delgado. I'm happy to be here with Monica, especially because we have a big relationship with the Hispanic and Latin people here in DC, and I'm happy to be here in this meeting. So any question that you have about any PPEs, just let me know.
Thank you, Rolando. I really appreciate you taking the time. I'm sure that your days are very long and you work very hard taking care of patients at Mary Center. So I want to start by saying that yesterday I participated in a candidate forum with the AFL-CIO here in Washington, and the nurses union was talking about the fact that at a local hospital, they're not being provided enough personal protective equipment, and that in many cases, that equipment is being recycled and reused more times than it is safe to do so. So this is a very big issue, not just because it puts the lives of the nurses and the healthcare workers at risk, but because it creates a risk for their families and for their loved ones and their community. It's also a risk in the workplace. So Rolando, can you say a little bit about how important it is to have this PPE gear in the work that you do?
So just for the start, PPE is just personal equipment that we will use when we have any kind of disaster. So this is going to be the barrier between life and death, between the sickness people and us. That's the only way that we can protect about any problems that the people have. So at the beginning for the PPE, we've never been prepared for such a pandemic that we need to just change PPE with every single patient. And with the hospital, they probably have a major equipment and a lot of the PPEs on the stock. The different with the primary care or small and clinic that we can use like a small package for probably 6 months.
Right. So
and at the beginning,
that you've had some of the protective equipment that you need, but it's harder at the smaller clinics?
Yes, because we never been prepared for change the PPD continuously. So we run out really fast. Even the first months we ran out, and it was the start of the pandemic. So everybody started getting more and more PPEs. So it was low on all this equipment.
Right. And that seems to be a challenge. It seems that the hospitals are also complaining that they're being charged too much money for this personal protective equipment. So I wonder who these manufacturers are that are allowed to sell in the district for these overpriced equipment. So that's one question that I would have as your elected representative. Who is allowing these companies to sell gear at inflated prices? So that's an important question. But now, Rolando, that we've been going through this health crisis for 7 months, do you think that it's easier now to find the protective equipment that frontline healthcare workers need?
No, actually, let me just go back to the first statement that you say on the hospital started reducing the PPEs, and yes, that's completely true. I remember at the beginning of the pandemic, we started using the N95 mask at least half of the day, and then we can change it to a new mask the other half of the day. We changed the gowns for every single patient because of the droplets of the patient every time that we do a test.
Right.
Then we started using 95 for a full day. Now the M95 because it's too hard to find out, especially the size of everybody who needs to have the size of FNet and the M95 mask. We start using and reusing we give you 5 masks per week, and then that mask we have to put it on the paper bag for example, Monday. I have to write down Monday on the paper bag, put it on the mask there, and I have to reuse it for the next week and then reuse it for the next week follow up. That is inconvenient because they say the virus can be disappear in the paper bag, but I don't believe it. Even though that you take it out of the mask and put it on back, you have the the way that you can get contagious from that. And
That's
also with the gowns was the same thing. The gowns we start using for every single patient, and they start using just one for whole day, and that can cause cross contamination between patients because not everybody have the COVID, but they just go to the COVID clinic just to do the test. And the problem, you have a gown with contaminated with coronavirus, you can get that to the patient who doesn't have it.
right. And Rolando, how often should a healthcare worker be tested, to find out if you've been exposed?
Can you repeat the question again?
Yeah, so in the course of your work, or let's say a nurse at a hospital, how often should they be tested? Should they be tested if they feel sick? Should they be tested every week, every day? What's the right thing to do?
For me, the best way to be tested for all the employees who were or be exposure with the coronavirus is for rotation. You need to be tested every week
Mm-hmm.
because you can be on the 5 days incubation periods days, and then you can come out positive the next week or the next Monday or the next Tuesday. It's between your rotations. I think when you have, for me, I work 5 days straight on the COVID clinic, and then I have to do what they should be do a test at the end of the week, and then in the follow week, if it's came out negative, I can start back again to work. But if it's came out positive, it has to be in quarantine,
Right, right. So
and it
there's
needs to be
a
a
lot
regular test
of
at least every week.
Yeah, there's a lot of risk in the work that you do. And I have a big concern when I learned that these nurses yesterday on this forum, they were saying that they're being forced to reuse and recycle PPE equipment,
Mhm.
which I hope that our listening audience understands that we have to advocate for our healthcare workers and for our nurses and our frontline workers. What other advice do you have for someone who's either looking for care or who is, in a job providing care?
So right now with this pandemic, remember, just if you feeling sick, just call to any primary care or your PC or your primary care provider to give you the information about where you can get a test. It's super important to get a test every time that you feel sick, even though you can make feel like you've been exposure with the COVID. just go and do the test, because it's a lot of symptomatic patient who's walking around and you don't know if you get it or you don't get it until you feel the symptoms.
Right.
Just be prepared, call you primary care and just go to the test. And for the people who is working on the first line, just be strong, because we are the last line that we have for these people who get sick.
Mm-hmm.
Uh, this is an evolution of the sickness. It just gets really quick from the primary care, just send it directly to the hospital, and we are the last chance that these people have to get better and to be safe.
Right. And I wanted to give us a chance to say that for many of us, my mother was a nurse for 33 years, and I would never want her to be exposed and to be required to be exposed while she's just going to work every day and doing her job. So I think all of us, we can't take for granted how hard our healthcare workers are working, but also the risks that they're taking. So if you hear of somebody who needs help and needs support and feels that they're not being protected at work, please let us know. And I want to give you my email, which is info@monicafordc.com. That's info@monicafordc.com. We need to stand together with our healthcare workers. We need to stand together with our frontline workers and make sure that they're not being forgotten, because so many months into this, and Rolando, you probably see this every day, people are feeling a lot of stress and anxiety, and it's not going away. So we need to make our world sustainable. We need to make sure that we're looking out for each other and that we're standing with our frontline healthcare workers. We're also flashing on the screen the email and my website, which is monicafordc.com. So if you want to know more about me as a candidate, you can find out at the website, but also let us know what are the issues that are important to you. What should we be fighting for? What do frontline workers need from us as advocates and as partners in protecting our city? Rolando, what else would you say to our listeners tonight?
Just follow all the CDC guidelines. Just wear the mask the most time that you can, even though if you are alone, it's better prevent than pay the debt after. If you are in a big crowd, just wear your mask. Try to keep you 6 feet of distance. Wash your hands every time that you can. If you have sanitizer with you, try that everything that you touch, just wash your hand with the hand sanitizer, and just
Right.
keep it safe. Just remember that this virus can get at people who doesn't work out. Remember, just work out at least 3 times, 30 minutes. That will help and improve your immune system. Take vitamin D and take vitamin C. That's
So
the
you're
best.
saying that at least 3 times a week, people should be working out for 30 minutes?
At, at least 30 minutes,
At
yes.
least 30 minutes.
And
So
taking
get your
vitamin
heart rate
D,
up.
yes, taking vitamin D and vitamin C. One of the biggest cases is just mostly of the population who get the COVID is getting lower on vitamin D. So it's something super easy just to take it.
I didn't know
Remember, just the
taking
sun is free.
vitamin D is good for you to build your immune system.
Yes.
That's good to know. That's good to know. Maybe not everybody has that information. Anything else? So working out 3 times a week for 30 minutes, taking vitamin D, vitamin C. What else is a good
And
way to take care of your immune system?
yes, and just eating healthy. Just eating healthy, do a balanced diet, because everybody just I even see that everybody just talk about you need to be protected, you need to wear the mask, but just the basic from the human being is just try you be healthy. If you are healthy and you have a great immune system, you can probably get through all this COVID without any problems.
That's great advice, Rolando. I want to say thank you again for doing the work that you do as a nurse at Mary Center. We really appreciate you. I want you to stay healthy and take good care of yourself as you take care of all of us. And I want to say thank you again to all our frontline healthcare workers. You are really standing between us and what could go terribly wrong. So we're very, very grateful for you. Again, my name is Monica Palacio, candidate for DC at large, and I'm hoping that we are helping and providing some good information tonight Please take care of yourselves, your immune system, and take good care of yourselves by wearing that mask everywhere you go. Right, Rolando?
Yes,
Yes.
that's
So
right.
keep those masks on. If anybody needs a mask or doesn't have access to a mask, please contact us and we'll help provide a mask for you and your family. We have disposable masks. We also have cloth masks that we're happy to share with anybody who needs one in case you don't have one and one is not accessible to you. So I want to say thank you to everyone who joined tonight. Stay safe, wear your mask, and thank you to Rolando again for joining us. Take care.
Thank you, everybody. Have a good night.